So we'll be sharing the video, the audio, and for future reference. So I guess we'll get started. It's just after 9:30. So my name is Chris Klaus. I'm a planner here at the Council of Governments, and we appreciate not only the folks online, but then also folks that are here in person. I think what we'll eventually do is there seems to be a larger people of coming in on the Zoom call. So maybe what I'll do is ask for folks on the Zoom call to be able to start, maybe just type your name, your organization, and an email. We probably have your email if you're in this meeting, but if you got a request from, a second hand or third hand, just put your email into the chat and then we'll have that. I don't know if we have a sign-in sheet or whatever. We can route that around here, just a piece of paper maybe to do that. So we are recording. Maybe mention that there are restrooms for those that are here. Restrooms that you probably walk by if you saw. You go out the store, take a left, and they're on the right-hand side. Mention also that this is the first time I think in a little while. Last time we met was in late 2022. There seems to be continuing interest in the discussion and the topic about monitoring and health data and the connections that we can put together. So, we've been contemplating and figured let's get the group together again. There's a lot of discussion, a lot of interest, and we've got some other things. There's a lot of things that have occurred in the last, couple of years since we last met. Our website is still live. It's still out there. All the previous meetings are out there. All the presentations are out there. This will be no different. I don't know, give us a couple of days and we'll get everything up there loaded to our website. So maybe at least we could, for those that are in the room, we could just go around and introduce ourselves. So maybe Daniela, we'll start with you.
Yeah. So Daniela Howard, air quality planner for the NCTCOG.
Hi, I'm Annalisa Garcia. I'm an air quality planner on our air quality technical team.
Jeremy Johnson, I work with the Texas A&M Transportation Institute.
Barry Lackman, Dallas City Environmental Commission.
Amy Hodges, Principal Air Quality Planner here in the Transportation Department.
Anna Thiesing, Air Quality Planner with the Transportation Department.
Jenny Narvaez, I'm also on the air quality team here at COG.
Kevin Overton, no affiliation.
Freddie Ortiz with the City of Dallas Office of Environmental Quality.
Lori Lewis, Tarrant County College Sustainability Manager.
So those are who we have in-house present today. So thanks everyone for making it out here to our office. And I see that we've got quite a bit of people that are online. So why don't we get started? We just have a couple slides between myself and Jenny to kick things off. So again, that health task force that we've resumed since I think it was like November of 2022. You can go to the next slide. The main thing that I think we have historically been working on since day one is trying to get some health data, right? So the overall objective that when we started this years ago was how can we utilize and benefit from the health data that may be out there and then monitoring data that is being collected. And the idea is for underserved or lower income or environmental justice areas, whatever the case may be, as a priority, but then everywhere else in the region, how can we correlate the two? If we're collecting health data, collecting emission data for whatever the pollutant might be, is there correlation? And how severe is it? How big of a deal is it? How can we use the monitoring and the information that we do collect to try to help us to identify what's the cause of the solution? Now, we are the transportation department of the Council of Governments. We are the Metropolitan Planning Organization. So our emphasis is if there's a transportation issue, then we could probably come together and collaborate and coordinate and come up with a plan, let's say, that could be trying to address transportation issues that may be impacting a particular community or neighborhood or the region above and beyond what we're already doing. But if it turns out that there's something else that's not transportation, we're not just going to walk away from it. We'll assist and aid and try to do what we can within what we can do to try to solve those solutions as well. And it'll probably be a lot of a lot of communication, a lot of coordination with the local government, the county, that wherever those emissions are coming from, the industry, wherever those emissions are coming from, a lot of coordination. So one of the things that we've been doing for a long time, and we try to at least showcase, because we still haven't found that nugget. We still haven't found that source that is going to be the health component. We've got the emission data, but it's that health data that for all these years that we've been having this meeting, we just haven't been able to secure a good source of data. We're not looking for, people's, specific personal information. We're just looking for some more generic higher level information, maybe at the zip code level, maybe at the neighborhood level, to be able to just identify, the general population that may be having impacts. Like if there is a particular neighborhood or a zip code that we see or we could find that perhaps there's a high level of asthma rates of people being admitted to, hospitals or health centers, that might be a trigger. We can correlate that possibly with some of the emission data that we have and see if there's that correlation to it. So before I get to so we've been collecting sources of what we're told of information, and thus far we've been coming up short with a good source of data. Now, since the last time we met in 2022, this is where we stand. Yeah. If there's other sources, then we'd love to know, love to coordinate. If maybe we're doing something wrong with any of these sources that we have here, let us know and maybe we can. So go ahead, sir.
So there are several to mention. The best one by far, probably the best in the country, is the Parkland Center for Clinical Innovation, which you don't have up there. Okay. PCCI not only has the data, they can drill down to, in their data, they can drill down to both to census tract, which is better than zip code, and they can drill down to block and address level. And they've specifically got on the Dallas County site, on their site, they have a health index because they've also pulled in all the social determinants data. And as an example, 75241, which has the batch plant thing, TCEQ just approved the permit for that, but we fought that. And for that, we were able to use data to show that 75241 has the second worst asthma vulnerability of any zip code in Dallas County of the 65 zip codes. It's great data. They've also got the ability to generate a predictive model that has an R squared of about between 0.7 and 0.8. So 70 to 80% accurate in predicting which child will be there. And their data is not just hospitalization data, it's outpatient data. It's not as complete as the DFW Hospital Council data because it's not all hospitals, it's just really, and it's also got insurance payer costs. The state of Texas now has an all-payer claims index that they've created by statute as well. That's still, as far as I know, work in progress. And then the last one, we just had a grad student for the summer for the Environmental Commission from Harvard Environmental Science. And he was able to show a correlation between polluting batch plants and the incidence of cancer, chronic respiratory disease, and diabetes using an EPA health index. I don't know the specific EPA health index, but I think that we've asked from the Health Committee of the Environmental Commission to present his data at the next Dallas City Environmental Commission meeting on the 14th. I don't know if it's formally on the agenda or not.
Right. We're already off to a good start. This is already some good feedback and information. We'll look into this stuff. You mentioned the first sort, Plano. No,
Parkland. Parkland, PCCI is a part of Parkland that it's actually a separate 501c3 owned by Parkland. They started by looking at hospital data to try and predict readmission. We're very successful in doing that. And then in conjunction with Parkland's Medicaid plan, when I was the medical director there, we developed the predictive model. And for that, we incorporated, that health plan has about 200,000, had about 200,000 members at the time. And then we said they've since pulled in data from a variety of other sources, and it has great granularity you can't get in any of the other databases. One of the things that we did, because we ran into the problem, we got down to the block and address level of PHI without specific permissions, so possible violations. What we developed was we developed a methodology, and basically the methodology is the person supplying the data strips off all the PHI identifiers, except for maybe block level. Block level would be outside the requirements if there's no other PHI, and strips off all the identifiers and keeps a unique number that only they know for the data. So you as the recipient can't identify the individual, only they can identify the individual.
We don't. Well, that's great. So we'll look into that further, probably reach back out to you, depending on any hurdles that we encumber. Because we've been told a lot of stuff and everything's come up dry. So we've been unable to access this.
I actually testified at the batch plan hearing using the data from that Parkland Center on the particular zip code. Okay. The other thing I would comment is you were looking for are there particular pockets? There's two A&M studies recently that have been done looking at air quality, and they're specifically looking at outdoor air quality from polluting plants, not transportation, but those involve the Joppy neighborhood and West Dallas, the Singleton neighborhood. And both of them showed correlations between reported health outcomes and air pollution levels. We've also done some work in housing. I've done some work in a housing complex in the Bachman Lake area, where we've shown that the indoor air quality in apartment complexes is worse than the outdoor air quality because of the problems with the indoor air quality. So there are ways of correlating the data up. There's this is great stuff, but frankly, your stuff is a bit dated. Yeah. And I know that's what you're looking for.
Yeah. So anyone else that would have any resources or suggestions?
Raised hand.
Okay.
Hi, this is Sade. So PCCI is great, but it's not free. And then I just wonder what level of granularity are you looking for to disseminate what information to the general public? Is this and what are the actionable goals for obtaining this information?
Well, the granularity is not going to be at the household level, neighborhood level. I guess we'll look to see how in depth the data can get us. More like a neighborhood aspect. We don't want personal information. We don't want street addresses. We don't want any of that PII information. And then, I think for your second question, I mean, once we collect the data, identify and try to associate it to maybe risks, health impacts in that particular community. Is there a current monitor in the area? Is there current monitors surrounding the area that may be able to identify what the potential problem or the cause of all that might be? It may have nothing to do with environmental conditions. It might have to do stuff with internal personal stuff. But that's what we're at least trying to identify not on a specific individual basis, but just as a more of a function of what's going on in a particular neighborhood, in a particular area, and what could be from the cause of it, so that we could come up with hopefully logical, meaningful solutions to minimize those impacts to the community.
I want to give you 5 numbers.
We got to be quick because we got to roll here.
75216.
Now this is all Dallas, right?
That's Dallas City. 75216. When you look at the Dallas County Health Needs Assessment, comes up at the bottom of the barrel on every health indicator you can think of. The only reason it's not the worst is the health access is actually pretty good in that zip code. But for instance, 75216 has the second worst mortality for African-American males of any zip code in the entire United States. From the Parkland Health Plan data, 13.3% of the population of the health plan of children who are in that zip code had, at the onset of the health plan's data, had severe asthma. 13.3% by the model, it's supposed to be about 3%. So you're talking about 4 times the incidence. By comparison, the zip code Mesquita's in has a 1.6% of severe.
Yeah. Okay, so anyways, go ahead. Yep.
City Health Dashboard from the Department of Transportation has an enormous amount of downloadable data.
Great, we'll look at that. And the city of Dallas, no question, from previous staff, current staff, have a probably the leading effort in the region on monitoring and collecting data and trying to do exactly what we're doing. So I'm not in here trying to say or disrupt what the city of Dallas is doing. Can it be expanded? And then how did that get expanded to the whole region? Because it's unacceptable that we can't do this right now where it's not provided to a similar level across the area as well. So there's our pitch on the data. Great discussion. The second slide here is just really, the 3-legged stool, if you will. We're gonna collect data. We want to collect data through monitoring, which Jenny will get up here shortly to talk about further, kind of our bigger vision. Obviously, the health data that we've talked about, and then the collaboration. Like I said, once we can tie these 2 things together, then I think it's a collaboration with the community. It's a collaboration with the cities, counties, the local governments, the policy officials, to how do we potentially solve these things. Maybe it's collaboration with the state. I'm not ruling that out. Talked about batch plants and permitting things. Those are clear issues. That's not really our deal per se, but we're aware that those exist, and we'd be more than happy to roll up our sleeves and have some more, involvement in that if that's what it'll take. So with that said, then let me pass it over to Jenny, and she'll cover a couple slides before I guess we get into our first presenter.
Okay, so thank you all for joining us this morning. Just a few things that I want to talk about. What you see here is a snapshot of all of the regulatory monitors here in the Dallas-Fort Worth region. You see that we have overall, it's 16 counties. That's the NCTCOG area. The shaded part it represents our non-attainment areas for ozone. I'm sure you all know this already, but I'm going to go ahead and cover it anyway. So of course we are under 2 standards, the 2008 standard, which is 75 parts per billion, and the 2015 standard, which is 70 parts per, did I say 75? 70 parts per billion. The majority of the monitors that are sprinkled around the area do monitor ozone. Some of them only monitor ozone. Some of them monitor PM10, particulate matter. Some of them monitor both PM 2.5 and ozone, and some just monitor PM. And so this is something, so these are all the locations of them. The numbers are the exact location of where they're at, what the monitor is called, if you will. So this is something that our staff looks at regularly just to see how everyone's doing. Sometimes these monitors do come offline, and that's something that, you know, we also work with the state, the TCEQ, to address and see what's going on there. But at any rate, this is our whole regulatory monitoring network in our area. Next slide.
Can I just mention that the key word there is regulatory?
Yeah.
We are not advocating for more regulatory monitors. We are advocating for non-regulatory monitors to help with the health and the awareness and to be able to aid us in understanding what's going on at these regulatory monitors. So if people put in more regulatory monitors, hats off to you. You know, eat your heart out. They're expensive. And I'm not saying we're buying like $100 monitors either. You know, we need some. There are certain parameters and levels of monitors that are acceptable, that are a lot easier to utilize, a lot less expensive than a regulatory monitor. It gets you in a statistical, I guess, window that can help us to help understand what's going on at these regulatory monitors. And where there's not a regulatory monitor, it's still beneficial because it kind of acts as one that we can utilize to help to understand, you know, what are some of the surroundings or the issues in that particular area.
One of the limitations on the non-regulatory monitors is making sure that they're calibrated properly.
Absolutely. Yep.
Of course. And so that brings me to my next slide is what we are calling Vision Zero for Human Health. And what we're doing with this, of course, because the whole reason why we want to put non-regulatory monitors, but good, decent monitors out in the area is really for the health and welfare of everyone that lives in this region. So we're developing, or we are in the process of creating a policy, a regional transportation council policy, where this would include, you know, us getting the ability to identify different funding sources for potential purchases, or, you know, working to put other monitors out into the region. Of course, developing partnerships, that's what we're all about, you know. Then, you know, being sure that the implementation and deployment of any non-regulatory monitors that do go out is done correctly. And, you know, we don't want to just go out, throw monitors on a lamppost. You know, we want to make sure that it's done right, and that we work with organizations that's what they do. Of course, public engagement, communication, anything that we do move forward with in terms of course, the Air Quality Health Task Force, this policy, monitors, projects, what have you. We have an ongoing dialogue with the public and try to, or we do communicate at all times what we are doing. And then any data that these monitors do record, we are going to evaluate and, of course, bring it back to the public, bring it back to our technical committee, bring it back to our council. And, you know, we want to, you know, not just take the raw data and throw it out. We're going to analyze it and see, you know, look and try to figure out maybe, you know, what do we see, what's important. And so, of course, we're going to, as part of this policy, look at monitoring, you know, try to build a data that Chris was just talking about, the health data, trying to see if there's some type of correlation between, you know, the health data, health records versus what's going on with air quality in our region for maybe a particular time period. Also looking at vulnerable populations, seeing how they're affected, looking around at our region for different hot spots that may exist, especially also for particulate matter. And then looking at low income and disadvantaged communities and see how we can help there as well. Next slide, please. Okay, so that's just a little snapshot of what we are in the process of working on. And this is our contact information. This is our website. Feel free to visit there. And I guess with that, I'll take any questions right now. And if there are none, we can go ahead and turn it over to our next presenter, who will be Carrie Paige with the Environmental Protection Agency.
One of the things I see missing from your plan is connecting. We do have a rich source of academically interested people who are busy working on these on the related topics and with information. Dr. Afalabi is on virtually from pulmonology at UT Southwestern. You've got Dr. Mattingly, I noticed, is on, and I would also mention Dr. David Larry and some of the work that's been done by the Downwinders Group and Jim Schermbeck in terms of pulling data as well. And there can be a rich source of both information and expertise.
Absolutely. And actually all of those members of those organizations have been invited and do participate on this health task force. They couldn't all make it today, but they are definitely going to be involved in this whole process.
Yeah, so all of the vision is we're not trying to reinvent the wheel. We're just trying to expand things. You know? The vision is to take all the work, the hard work that everyone's done thus far. Can it just be in a one-stop shop type location? If you live in the city of Dallas has a portal, maybe that's good enough for you. But for us as a regional person, we'd love to be able. It's almost like a Purple Air. I don't mean to. But you go to Purple Air, they've got all their monitors, you know, in this whole big, you know, information system, which is pretty cool. So think of that, but it's not Purple Air. It's all these other regulatory and non-regulatory monitors that we're able to just tie into or tap into. And there's a lot of opportunities that we have to be able to expand this network, that whether it be financial grants or incentivized things, we have some money coming in that we're going to be expanding our ozone and our PM monitoring. But all of this will eventually just be, hopefully, just a smattering of little dots throughout the whole region that anyone and everyone can go to and look at and zoom into what their area of interest is.
Okay, well, I think with that, we'll go ahead and turn it over to Miss Carrie Paige. Carrie, are you there?
I am. Can you hear me?
Yes, we can.
Wonderful, wonderful. Thank you so much. Thank you for inviting me. I was asked to review changes to the National Ambient Air Quality Standards for the fine particulate matter, also known as PM 2.5, and also to provide an update on the recent reclassification of ozone non-attainment areas in Texas. And I'll begin with the revisions to the PM NACs. May I have the next slide, please? So on February 7th of this year, EPA strengthened the level of the primary annual standard for PM 2.5 to 9.0 micrograms per cubic meter. EPA, in that same action, also revised the air quality index, and that's what we use to improve public communications about the risks from PM 2.5 exposures. And also in that action, in February, EPA revised the monitoring network to enhance protection of air quality in communities that are overburdened by air pollution. Now, these are the things that EPA revised, and I want to emphasize the things that EPA did not change regarding the particulate matter standards. The primary and secondary 24-hour PM 2.5 standard stays at the level of 35 micrograms per cubic meter. The primary and secondary primary and secondary 24-hour PM10 standards stay at the level of 150 micrograms per cubic meter. And the secondary annual PM 2.5 standard stays at the level of 15 micrograms per cubic meter. Next slide, please. I wanted to go into a little more detail on changes to the monitoring network for the PM 2.5 standard. So EPA changed the monitoring network design criteria to include an environmental justice factor. And this will account for proximity of populations at increased risk of PM 2.5 related health effects to pollution sources of concern. So, for example, a nearby airport or a nearby industrial facility. And the network design change does not add a requirement for new monitors, but it utilizes existing sites and ensures that at-risk communities are considered if existing sites need to move. However, for the areas that do have additional requirements to add state or local air monitoring stations, a monitoring station is to be sited in an at-risk community where there are anticipated effects from those nearby sources. And again, possibly an airport, an industrial facility, a rail yard.
Sounds like
Slide, please. So the other thing that's connected to this revised air quality standard will be designations. So this happens whenever EPA revises a national ambient air quality standard. The Clean Air Act requires that designations be made within 2 years of promulgation. Designations identify areas that meet or do not meet the revised primary annual PM 2.5 NAAQS, along with areas that contribute to the violations in those areas. So states and tribes will be submitting recommendations to EPA for the areas in their jurisdiction based on the most current, complete, quality assured data, which will likely be the 2021 to 2023 monitoring data. We expect to receive those recommendations from the states and tribes early in February of 2025. EPA performs a 5-factor analysis for each area that has a monitor that is violating the primary annual PM 2.5 standard. These factors include air quality, emissions and emissions-related data, meteorology, geography and topography, and then jurisdictional boundaries. May I have the next slide, please? So the results of the 5-factor analysis that EPA performs forms the intended designations for each state and each area. EPA will announce its intended designations in the Federal Register, which starts a 30-day public comment period. We expect that this Federal Register announcement will be published early in October of 2025. States and tribes will have 60 days to provide additional information to support their recommendations. After considering comments and all information, including the most current, complete, quality assured data, EPA expects to finalize designations by February 7th of 2026. And we anticipate that those final designations would be based on 2022 through 2024 monitoring data. I want to add that the Federal Register announcement will have an electronic docket number. And once published, that docket can be viewed through regulations.gov. The 5-factor analysis for each state will be provided in a technical support document, and that will be, all of those technical support documents will be posted in the electronic docket. Next slide, please. Now, the second topic I was asked to address is the recent reclassification of the Dallas-Fort Worth, Houston, Galveston, Brazoria, and San Antonio ozone nonattainment areas. These areas were reclassified from moderate to serious for the 2015 ozone standard. And just as a reminder, the level of the 2015 ozone standard is 70 parts per billion. That applies to the primary and secondary standard. Next slide, please. little bit of background on this reclassification. On October 12th last year, Governor Abbott requested that EPA reclassify the DFW, Houston, and San Antonio areas from moderate to serious for the 2015 ozone standard. I want to stress that this is a voluntary reclassification. It is not based on a determination that the areas failed to attain by their moderate attainment date. On January 26th of this year, our proposal to grant Governor Abbott's request was published in the Federal Register. This started a 30-day public comment period that closed on February 26th of this year. We received comments from 8 different entities. And most of the commenters agreed with EPA's proposal to grant the reclassification, though there was some disagreement from commenters regarding the Clean Air Act requirements that apply to the reclassified areas. And all of the comments that were received are posted in the docket for this action. And I can go over a little bit more detail on that docket at the end of this presentation. May I have the next slide, please? Okay. A little bit more background on this reclassification. So going from moderate to serious is just one step. And these areas that have been reclassified as serious have 3 more years to meet the 2015 ozone standard. And they must implement additional Clean Air Act requirements in addition to the requirements for the marginal and moderate classifications. And I've listed those requirements here for you. And I've also provided the attainment dates for these areas. The San Antonio area is the only area in the United States that has an attainment date that it is different from August 3rd, 2027. And that's because during the initial designations, the state and the San Antonio area submitted some additional information that EPA wanted to take a closer look at. And so we moved ahead with designations for the rest of the United States and then focused on the information that was submitted for San Antonio and finalized designations on September 24th, 2027. Next slide, please. So I wanted to show the improvement that has been made in these 3 areas that were just reclassified as serious. And this shows the ozone values over time. This chart actually goes from 1988 through 2023. And I put a vertical line at 2000 because I was really wanting to focus on what has happened in the last 23 years, really since we had an 8-hour ozone standard. The first 8-hour ozone standard was promulgated in 1997. So I kind of felt like 2000 might be a pretty good starting point on this. The Houston area is the blue line, or the topmost line. The purple represents the Dallas-Fort Worth area, and then the green line represents the San Antonio area. And then there are 2 dotted lines, and those represent the 2 ozone standards. And as you can see, these areas are very obviously not meeting the 2015 ozone standard. We have additional work to do in all 3 areas. But again, there has been significant progress made, specifically in the Dallas and Houston areas. And the Dallas and Houston areas have been designated as non-attainment for much longer than the San Antonio area has. Next slide, please. Okay, so my contact information is here. Whether you have a question today or tomorrow or 6 weeks from today, please don't hesitate to contact me with your question. And it doesn't have to be a lot of questions. You can send me just one question and I am happy to help you. If you go to the epa.gov/NAAQS site, you can see information on EPA's review of all 6 national ambient air quality standards. And you can also look at, for example, the risk and exposure assessments, the integrated science assessments that were performed for prior reviews on any and all of the standards. So there's a lot of information at that site. Regulations.gov is the site of our electronic dockets. And at that site, you can enter the docket number. If you don't know the docket number that you're looking for, you can enter information into the search box. If that doesn't get you anywhere, please send me an email and let me know which docket you're looking for, and I'll send you a link. Sometimes search engines don't work as well as we'd like them to. And then the final link is to the Clean Air Act text. If you're looking for any information on areas that get reclassified, what does the Clean Air Act require? Or if there are other aspects of the Clean Air Act that you're interested in, you can find it there. And if you're feeling a little bit lost looking through it, again, please send me an email and I will help you find what you're looking for. And I'm happy to take any additional questions.
Thank you, Carrie. Are there any questions? Maybe we'll start in the room.
Actually, I do. So why would the governor volunteer to put us into serious non-attainment? Is there any benefits?
Yeah, well, so consistent with the Clean Air Act, the governor doesn't have to say why. Any governor can request a reclassification to a higher classification for a non-attainment area for any reason, and pretty much at any time. It was a good idea for these areas because they are not meeting, they're still violating the 2015 ozone standard. And if the governor had not made that request, EPA would be proposing to reclassify them for failure to attain by the attainment date. So in this, by requesting a reclassification, the state has additional time to work on their implementation plans for the serious area, more time than they would have if they'd waited and EPA had gone through a finding of failure to attain. So it gives them more time, again, to work on their attainment plans, to do their modeling. It doesn't give them, their attainment date is the same as it would be regardless. But at least this way, they kind of get a head start on working on the plan for the serious areas.
Okay, thank you.
You're welcome.
I have one question. Carrie, this is Kevin Overton. How many PM 2.5 monitors does the region have? And can you kind of give me a breakdown of which ones are the more modern BAMs type? How many are the older, physical type?
Kevin, I'm so sorry. I don't have an answer to that question, but I can get that information for you and share it with.
That's okay. I can look it up.
Okay. I'm sorry.
Just curious if you knew it all. It was just something that occurred to me when you put up your slide with how many monitors there were. Thank you.
Are there any other questions for Carrie in the room? Okay, I don't see any online. So, okay, well, thank you so much, Carrie.
You're welcome. Thank you.
Yeah, we'll go ahead and move to our next presenter, Mr. Jeremy Johnson, who is with the Texas A&M Transportation Institute. So I will turn it over to him.
Thank you. So I was asked to present on this about our work that we've done with non-regulatory monitors. So I'm just going to go over quickly kind of our experience, a couple projects we've had with them, In interest of time, I didn't get into any analysis of the data or reporting of what the data showed. But a lot of these are publicly available if you're interested in how any of them went. Next slide. So just a little bit about TTI in case you don't know who TTI is. We are part of the Texas A&M University system. So we are a research-based arm of the system. We don't teach, we don't grant degrees. We're strictly research-based. We have offices and presence throughout the state. I'm actually located in the headquarters office in Bryan College Station, but we kind of have offices everywhere, including here in Dallas, Fort Worth. Next slide. TTI touches anything and everything to do with transportation. There's somebody at TTI that is an expert at it if it relates to transportation. I'm actually in the environment group. That's where I work. We do a lot of work with air quality, with this type of projects, but we also do a lot of emissions testing on vehicles and those sorts of tests. Next slide, please. This is actually where I'm located. It's a new facility we're actually expanding, but that's where we run all of our projects out of. So again, everything from air quality monitoring to emissions-based research. We partner with electrical engineering to look at electric vehicles and their impact not only on emissions, but the grid and how those are going to interact as those come more and more online. So that's where we're located. Next slide, please. So using non-regulatory monitors, one thing I will say, if I slip up and call them low cost, I'm talking about non-regulatory. There's kind of a transition from calling them low cost monitors to non-regulatory monitors. So every once in a while I slip up, I apologize if I do that. So as everybody knows, EPA regulates monitors that can be used, but they are, as Chris mentioned, very expensive. They take a lot of work, a lot of upkeep, a lot of maintenance. So these non-regulatory monitors are options to use. They obviously have some give and take for comparing them to regulatory monitors, but there is a purpose to them, and if they are used in the correct way, they can be very, very beneficial. They're much quicker to install. You can plug them in, start collecting data pretty much immediately, but you do have to know kind of what you're getting out of them. This is a couple installs that we've done here. It's hard to see, I know, from far away, but actually the smaller of the two boxes that's mounted on the two left-hand side pictures, those are the actual monitors. The bigger box is actually the battery that powers them. So the size is very small, and I know Freddie has one example that's a very similar size to the ones we use, but they're very small. They're easy to put up. You just kind of have to deal with power issues if you don't have power at the site. Next slide, please. So performance. So I kind of categorize them in a couple different categories. The very low cost, or the citizen type, is what I call them. Those are the handheld size, so you can hold them in your hand. You can mount them on a, you can wear them, or you can put them in your house. They're very, very small and very, very low cost. A couple $100 at the most, and you get some data from them. But they have very few features other than providing essentially the data, right? They're very, very simple, very easy to use. And then what I call the research level non-regulatory monitors, those have a few more features. They're easy, they can be calibrated. Most of them, a lot of them, at least the ones we have experience with, do have some sort of cloud computing aspect of that. So you could put them out in the field, you can connect them to Wi-Fi, you can connect them to cellular, and you can go out and get data. A lot of them have internal graphs and charts that they provide, that they do some analysis, if you want to call it that, on their own. But typically that's not publicly available. That's available to whoever purchases them and has a login to their system. But they do have it. And the good thing about those is if you're monitoring them, they will tell you, some of them at least, will tell you if they go offline. So if they lose power, or if the battery goes dead, they will send you a message, say, hey, I'm offline, and you can go check it and replace it, which does come in handy a lot of times when you're powering these off of batteries. Next slide. This is a very good site to use. Not all non-regulatory monitors are the same. Some are better than others. Some are obviously more expensive than others. And if you have a project where you're looking to monitor a certain pollutant and you don't know which monitor you want to use, you can't go out and purchase all of them and test them and then decide which one you need. So the South Coast Air Quality Monitoring District has this site here. They do a very good job of they test these monitors, they buy one, they test them in the field, they test them in the lab, and they create this report. You see, this is a screenshot of one of the device we actually use, but they list a bunch of different monitors, and you can go look at how well they perform. Do they measure PM well? Do they measure what pollutants they measure, how much they cost? And there's multiple pages to this report. So if you do have a project where you are looking at installing monitors and you don't know which ones you want to use, that's a very, very good resource to use. Next slide. Calibration. I know somebody mentioned calibration earlier. The monitors do come, at least from some manufacturers, some of the ones we used, calibrated, but they're calibrated. They may not be calibrated to a range of data. They may be calibrated to like a baseline low level data. So one thing we always do for any project where we're installing these in the field is we calibrate them before we use them. There are many different, there are a few different methods that people use to calibrate them. The one we use and the one we prefer is co-location. So we actually install them at a regulatory site right next to the regulatory monitors. We collect data for a couple weeks to a month. We compare that data, and then we're able to enter calibration factors essentially for each pollutant, for each device, to improve their performance when you actually go out and use them in the field. This is actually the site that we use is the site in Hinton here in Dallas. So we install all our equipment there. This is the one you see. This is a bunch of equipment. The R's are the ones that are, I think there's 9 or 10 of there or something. Installed at Hinton, and then on the right-hand side, the little white tube is kind of the inlet to the regulatory monitors. So you see, we get really, really close so that we're trying to measure the same thing. If you go to the next slide. This is just an example of what calibration does to the data. So this is a device we got. It's the AQY. It comes from a company, AirQual. That's who we typically use. The green data is the Hinton data. I think this is Ozone. Yeah, this is Ozone. The purple data is the data pre-calibrated. So as you can see, it does fairly well, especially for a non-regulatory monitor. One of the things you'll notice in this is the purple data, the non-regulatory data, kind of has a low limit of somewhere around 10, where it was just cutting everything off. It never ever measured below 10 or whatever that number is. But when we calibrated it, if you'll go to the next slide, now the orange is the new calibrated data. So this is the same data, the same instrument over the same time period, pre and post calibration. And you can see how much better the orange line matches the green line as far as the data goes. Now, it's not perfect, and we understand using these non-regulatory monitors, it's not going to be perfect, but it's much, much better after, excuse me, after calibration. So that's why we always calibrate our units, no matter what the manufacturer says. We go calibrate them before we use them. Next slide. A couple projects that we've worked on. Next slide. This is Breathe Easy Dallas. This was a couple years ago. We worked with the city of Dallas. Kevin was a big part of this project, where we installed 12 monitors at the Hinton location for a long-term comparison of the non-regulatory to the regulatory data. So we had 12 sensors there for, I believe, 1.5 years is what it turned out to be. So we had a wide, I know we don't get extreme temperatures in this area of the country, but we were able to go summer, winter, summer again time frame, comparing how these non-regulatory monitors compared to the regulatory data. And then after that, we installed 9 on school zone flashers for 1 year in the Dallas area and collected that data. There was some health aspect related to this. I don't pretend to be a health expert. We have people at TTI that are health experts. So they also took this data that we were using and looked at some of the asthma data that they could get from the area to look at the two. But I won't get into that because that's not my area of expertise. Next slide. This is what we currently have going on in Dallas. We have 4 monitors installed in 2 areas in Dallas. We are coming up on the end of the official project data collection. But we hope to keep continuing it going forward. We're wrapping up the report as we speak. So this is the area that we've got them installed. They're at 4. These are actually located at parks in Dallas-Fort Worth area. The picture on the right is one of the installations, and then you can see the map where we have the four monitors installed. Like I said, this project's coming in to an end. We're kind of winding down the analysis of the data. We're doing a lot of comparisons of this data to the regulatory monitors, even though they're not at the same place, to see how these areas are impacted versus what the regulatory data is showing. Next slide. This is kind of one example of what we saw. This is a range comparison. So typically when we report the data, we report the AQI values, not the raw data values. We just feel that's a better way to compare the data. So you can see they're pretty close to the same most of the time. 0 to 50 is the good value or the good ratings for the AQI, and most of the time they are in the good ratings. We did see the one that was a little bit high, but they were still all fairly low. So nothing major, but this is kind of how you can see the different sites perform differently over the same period of time. Next slide. So this is a project we're working on. It was just implemented and we just kind of started the data collection. It was sponsored by NADBank, North America Development Bank. This is a border crossing project. So we actually have 4 monitors installed at the border crossing in Laredo. I think one of them is on the Mexico side and the other 3 are on the US side. But these are actually at the crossing where the trucks come back and forth. So we're looking at the data as the truck goes. We also have border crossing time data, how long it takes the vehicles to go from one side to the other. And we're comparing that to see, okay, as the wait times essentially get longer, how does that impact, or does that impact the air quality in the area? Next slide. So we do have a dashboard. Oh, okay. I didn't know if that was going to work. That I tried to embed the website. So it is a live feed of the data. There's a link down there on the bottom that you can go to. That might help if you click that. I don't know if it's going to work or not. We'll see. So, okay, so it's coming up. So this is the live data feed that we've got coming from these monitors at the border. This is taking data that's collected from the non-regulatory monitors that we have imported into a database that we can then use to publish the data live. So this is the border crossing. There's a couple, it's hard to read, it's small, but there's live data. So this is the current data as of, I guess, 9 o'clock is the last time they were read. One of them may be down for maintenance. It looks like it hadn't popped up since the 23rd, but there's information on top. So you can go look at the historical data at each of the sites. But this is something that we created. This is not part of what we get from the sensor company for the monitor company. So we were able to take this data and you can do kind of your own analysis and present it to whoever you want, however you want to present it. Next slide. That's all I have. Any questions? I'm happy to answer them now, or you can reach out to me via email or phone. I'm happy to answer any questions.
Thank you so much, Jeremy. Are there any questions in the room?
Jeremy, who's doing the data analysis on the ones you have in Dallas?
Right now we are, but I know Freddie and Maritza are also with the city of Dallas. Sorry, right, are also doing some of that as well, or going to be doing some of that. But right now we're doing most of it to get the report finished up.
Looks like we have a question online.
Hi, this is great work, and this is Sade from UT Southwestern. This is great work and really interesting. I think one of the things that I was really surprised about when I was out in the community, especially when they were Texas A&M was presenting their data, is that a lot of the community was saying like they don't trust they don't seem to trust the air quality monitors unless it says something is bad sometimes. And that was a little bit shocking to me. And it seems like this correlation between the AQI and, these non-regulatory monitors might be a little bit more helpful. Is that something that's really expensive, or like the software that kind of makes that conversion? Is it really like time intensive? Does my question even make sense?
Yeah, so essentially we've kind of already built all that in-house. So if we have the data, we can very quickly make that same comparison that graph that I showed to to any data that we have, any instrument that we have, as long as we have the data. So doing the comparison is it's really not that difficult. The biggest thing is actually getting it right, the cost to get the equipment and getting it installed. But once we have it, that analysis is pretty straightforward.
Okay.
If that answers your question.
No, that really does answer my question. I mean, I don't know. I like the not necessarily having like the, never mind. Sorry. I'm rambling.
Yeah, the colors are easier to understand. Or the AQI.
Yeah, and that's and again, I kind of didn't get into a lot of the results that we published just for time, but whenever we and if you go to that link for the one in at the border right now, we report everything in the AQI atmosphere, right? So the green is good. I think go to slide 3 maybe, or not slide 3, page 3. Go over one more. Actually, click back to dashboard on the top. And then click on AQI info. Oh, there we go. Right. So this is typically how we report everything when we're reporting it, because this is a way for, people see green, they think good. People see the maroon at the bottom, they think bad, unless it's A&M maroon, which is obviously the best. But we tend not to report raw or calibrated measurements when we're reporting this, especially if we're reporting it to the public, because 1 microgram versus 50 micrograms versus 1,000, that it's just a number a lot of times to the people that are reading it. But if we can calculate the AQI and present it as a green, yellow, green, yellow, red, that's easier for them to see. So typically we shy away from not publishing, but reporting the raw values that we're measuring. And we try and go into this realm of was it good versus was it moderate?
And then I guess my next question is, like, this is a good dashboard, but how accessible is this dashboard for folks and things like that?
So this one was created specifically for this NADBank project. I mean, it's publicly available. The link is on the bottom there. You can get to it. You can go to it and see it. But we can. I mean, the availability is it's a matter of where you put the URL and how much you publicize where it's at. It can easily be readily available to the public.
Okay, thank you.
To illustrate, I think this is great stuff, and to illustrate the practical value, a number of years ago when I was the president of the Asthma Coalition of Texas, there was a project done down in the Galveston, Houston area where they started measuring air quality, and basically that project was also replicated, I believe, in Fort Worth later on. What they did was they started notifying the schools when the levels got up to certain things, and the schools were actively, on days with really bad air quality, they would do whatever their physical education activities were, and the breaks were indoors. And from that, I believe they were able to identify that they actually had better out, lesser symptoms from asthmatics. And so there are practical applications. One of the things we at the last meeting we had at the Environmental Commission, we spent a lot of time reviewing the data from the very extensive monitoring system, non-regulatory system that the city of Dallas has developed. And the conclusion, I think, of all of us who looked at it was that we needed to do something to make it more user-friendly to non-environmental science, and we've really made with this chart is perfect.
I don't take credit for the chart. It's an EPA chart, but that's what we use, right? We just, it's easier for them to see versus numbers. Yeah. Yeah.
I agree with the fact that the color system on the AQI is easy to understand. My hesitation in adopting this full-fledged for this sort of thing is though that AQI is rather difficult to calculate accurately. It requires extensive background data, and when we take a 1 hour average from one of these non-regulatory sensors, and say it's 50 parts per billion, and we look up and say, oh, 50 parts per billion for ozone is yellow, then that doesn't necessarily mean that that's the actual AQI at that moment.
Correct. So that should be pointed out, right? This AQI value of 0 to 50 is not the measured value of the pollutant. There's a very in-depth calculation that you have to go through that you get to an AQI of 0 to 50 for each pollutant, but that doesn't mean you're measuring, you're not measuring 50 ppbs of one pollutant and 50 micrograms per meter cube of PM. Those aren't the same. Those aren't both the good level. So yes, this is not just taking the measured values and reporting them as AQI. It's taking the measured values, calculating the AQI based upon the formula, and then presenting them as AQI.
I'll go further. I think that probably, I guess, 10 years ago, and Carrie can probably correct me if I'm wrong on that, the EPA had a program called Village Green, and they had some early non-regulatory sensors that they put in certain locations around the country, and they used a different coding scale. They used I don't remember what color it was, but they used a light shade to a dark shade. And when we set up the decamp program in Dallas, we adopted that in theory, maybe not in the actual way that they did it, but trying to avoid, especially because if you put down, if you put your ozone and you say anything greater than 70 parts per billion is red, like the actual, regulatory monitor, just because that low cost or non-regulatory sensor says it's 70 parts per billion doesn't mean that's what it is. It could be 60 parts per billion. It could be 80 parts per billion. So I think danger are, I guess at least I have a hesitation in telling people that there is that borderline there, and wow, you're over this, and yeah, the air that you're breathing is really bad for you. We're just making, recommendations, I guess.
Correct.
Not
you have to. It's important that it's also known that the data is coming from a non-regulatory monitor, because as you said, there are the non-regulatory monitors by definition are not going to perform quite as well as a regulatory monitor. So if your non-regulatory says 51, well, you're just over that. So maybe you're really in the green where we're reporting yellow, vice versa, right? Maybe it's telling you it's 49 when it's really 52. So it's reporting green, but it's really yellow. So there are some, it's not a perfect system.
No, it's not.
By any means, but yeah, for the purposes of them, it's
like I say, I think there's some, I don't want to say danger, but some risk in using the exact AQI scale for the public. That's just my thoughts. I just want to share that.
The other thing is that follows up on Kevin's point is that to the point of the first discussion that we had, we're still trying to understand and don't precisely understand the connection between health outcomes and particular levels. And we that the AQI is one measure over time, but the problem is we don't really know, for instance, whether if you have a single high spike, it's worse than constantly moderately high levels. We just don't have that granularity of understanding of the effects yet.
We do have a hand raised on the call.
Hi, yeah, so my hand is raised because I liked the shaded the shaded plan schema, and that there were kind of levels and you can see where there were spikes and things like that. I felt like that was pretty informative, but you know, I was a little shocked when I saw people say, we want to see the red, we want to see the spikes, we want to see this. And so, you know, I wonder if we're being a little bit more paternal than we need to be. And maybe if it is accessible, if it is inexpensive, if it is inexpensive and possible, that the AQI might be something we need to do. So I'm a physician. I'm very, you know, we've been accused of being paternal all the time. But in asthma, you know, self-management is really important. So we do have green, yellow, and red for their symptoms and ask them specifically, you know, you can do this at home, you can do this at school. If you have these symptoms, this is the medicine that you take and this is how you take it. You know, and we've translated that to many other more complex disease processes because that self-management has been really important and really, really helpful. So I think maybe more research needs to be done into it and more, you know, seeking out what the attitudes are of folks that are utilizing these things or want to utilize these things. But I do wonder if it's time to rethink some of that in ways that might be even more accessible than it is right now.
Okay, are there any other questions for Jeremy? Oh, thank you so much, Jeremy. Okay. Next, we're going to turn over to Freddie Ortiz with the City of Dallas.
Oh, yeah.
It's right over here.
Oh, okay. So, got a monitor here for you guys at home. Here's our AQ mesh monitor. I'll just put it right here. Everybody that's here, we can, after the presentations are done, we can take a look at that. So good morning, everyone. My name is Freddie Ortiz, and I'm an Environmental Coordinator 3 in the Office of Environmental Quality and Sustainability. And I'm happy to be here today to give a presentation on the Dallas Community Air Management Program, or DCAM. In this presentation, I'll go over the background and history of DCAM, sensor deployment, program outreach and sensor summits, challenges we have faced, and next steps for our program. So, sorry about the typo there, about the 12 sensors, but so Jeremy, Kevin, correct me if I'm wrong, but you know, DCAM evolved from Breathe Easy Dallas pilot project, and it was collaboration between the city, Texas Trees Foundation, Nature Conservancy, and Texas A&M Transportation Institute to install air quality sensors pods near DISD elementary schools. And the purpose of this project was to better understand the performance of low-cost non-regulatory sensors, to better understand the role that local air quality has and risk of developing asthma, to gather neighborhood high-quality data, neighborhood level high-quality data, and to contribute to the local and regional air quality data. Next slide. Thanks. So DCAM helps us meet Goal 8 to Action 2 of our CCAP, and we have utilized both the EPA environmental justice screen tool and Dallas's own EJ screening tool, developed by DPI and OEQS when considering pod location deployment. Slide. So our network has grown from 5 sensor pods that Kevin Overton and Christopher Morris installed in the field in February 2023. Now it's grown to 24 pods deployed across Dallas by the spring of 2024, with at least 1 pod located in each council district. The sensor pods we have purchased are manufactured by EQ Mesh. Before we install an air sensor pod out in the community, each pod goes through a co-location process Jeremy talked about. Each pod spends about 2 weeks taking air quality measurements at the TCEQ continuous air monitoring site on Hinton Street. After the co-location process is done, AQ Mesh compares air quality levels measured by TCEQ air monitors to the data collected by our AQ Mesh sensor pods. And then, like Jeremy mentioned, the specific correction factor is calculated for each air pollutant for each pod to bring up or down the pod's data to be closer in line with the TCEQ's measured data. Once the pod is installed in the community, it transmits air quality measurements via the internet to AQ Mesh using the cellular antenna there. The data is run through a formula to add the correction factor to each air pollutant, and then the data is posted on a secure site where Maritza Figge and I can grab the air quality data that we collect can be used by the members in the community to better understand local air quality, used for land use planning, zoning cases, air quality investigations, asthma education outreach, and environmental studies. Excellent. Sensor pod locations. So here are the first 5 sensor pod locations done by Kevin and Chris. So we have 2 in West Dallas, 2 in the Dixon Circle area, East Dallas, Southeast Dallas, 1 in Jobbie. One thing of note, our sensor pod at the Fish Trap Lake Park, we switched it out with a pod that had an SO2 sensor in October 2023. Slide. And then in November of 2023, Maritza and I installed 8 more sensor pods, mostly at parks and libraries, Mountain Creek Library in the south, probably our southernmost pod. We got Park and Weiss Park, West Haven Park. The next slide. Flagpole Hill, Muddy Graham Park, so that's a soccer complex that we have, the zoo, and then 2 in Floral Farms area, which is near the landfill, kind of 310, I-45 area. Next slide. And then in 2024, we installed 8 more pods, 1 in near Tommy Island Recreation Center. That one's kind of interesting because it's next to kind of a truck stop. Willis Winters Park, Friendship Park, and we actually had a great celebration event to install the sensor pod at Choppy Mama's Farm during the Earth Day event. That's the picture. So this slide shows our sensor pods broken out into 3 different groups. Pod A, groups A pods have NO2, ozone, PM 2.5, and PM 10 sensors. Group B pods have nitrogen dioxide, ozone, PM 2.5, PM 10 sensors, plus a sulfur dioxide sensor. And group C pods have nitrogen dioxide, ozone, PM 2.5, PM 10, plus a total volatile organic compound sensor and a carbon monoxide sensor. Slide. So we have a grant with the the EPA State Environmental Justice Grant in West Dallas, zip code 75211 and 75212. We're in the final months of this project to measure neighborhood level air quality in West Dallas. This project is paid for by the EPA Environmental Justice Grant, and we have partnered with Texas A&M Transportation Institute to install sensor pods built by Aeropol at Emmett Carter Park, J.C. Zaragoza Recreation Center, Arcadia Park Recreation Center, and Martin Weiss Park. And then all the sensors measure ozone, nitrogen dioxide, PM 2.5, PM 10, and that data from those monitors are displayed on the DCAMP dashboard. Slide. So the EPA government to government forest district grant. So the city was notified of this grant award in the fall of 2023, and OQS is currently working with the EPA to complete paperwork to officially receive this grant award. And the purpose of this grant is to measure how vegetation improves air quality. And again, we're going to partner with Jeremy and DTI to put air quality sensors. Okay. Pollutants detected, levels detected of note. So during the spring of 2023, 5 ozone sensors in operation detected high levels of ozone. So this matches up to the increased formation of ozone that happens in the summer, as well as the 50 ozone exceeded states that occurred last summer. We also observed high NO2 levels detected by our sensor pods in the summer. We concluded that this was an error due to our region's high temperatures and high humidity impacting the NO2 electrochemical sensors. And then last year in March and April, we observed high spikes of NO2 at the Mill Creek batch plant. So that is a place where it's kind of part of the city project. They're building they're digging a huge drainage tunnel to bring stormwater from Central Business District area kind of towards Artmark Lake Creek in the southeast portion of Dallas. So we had a sensor there, and we observed high spikes of NO2 during March and April. And so we worked with DWU, and we concluded that diesel-powered heavy equipment were likely idling while parked. So the contractor resolved this issue, and as a result, the NO2 levels went down. Next slide. So outreach. So we are informing the community of the air quality data we are collecting, as well as about our program through our DCAMP dashboard, posted data report summaries, community engagement, and sensor summits. Next slide. Okay. Yep. OQS collaborate with, or we actually do collaborate with DBI to display air pollutant data from each sensor pod on the DCAMP dashboard. We are on our second version of the dashboard, which has a better user interface and user experience than the previous version. People can access the dashboard from links on freedallas.net, DallasClimateAction.com, or scanning a QR code like that one there on the slide. Next slide. All right, this is an example of what the public would see. Of the homepage of our dashboard. The numbers across top show the averages of each pollutant measured across the sensor pod network for the previous 24 hours. Over here we have an explanation of the different pod groups and what pollutants they measure. Got a map of here of where all our sensor pods are. So as you can see, the groups are color coded, red, green, and blue. And pods here on the map. If they're red, then they're in group A and measure those pollutants. Green be there. Those that are grayed out are offline.
All the reds from South Dallas.
Yes. And over here we have a legend here of what the different abbreviations are. There we got the different color levels indicating levels, those that are very high that are actually exceed the national area quality standards are the dark blue there, and we'll see it on the next slide. But we also have Arlo there. So that's COG's mascot for the air quality. So that armadillo actually changes based on the air quality for the region using the AQI numbers or colors. So it does change. Next slide. So here is an example of what the public would see for a specific sensor pod. And this one is for a pod located at Choppy Mama's farm. On the right side are a collection of gauges that indicate the 24/8 or 1 hour rolling average for pollutant measured by the pod. And different blue shades indicate low, medium, and high levels of the pollutant. And this is an example of the trend lines for a pod. And here you can see, you can actually choose dates of the data for the pod, and it'll graph out the pollutants. Next slide. Sensor summits. So we've held our first sensor summit at City Hall last year in September. UTD hosted the summit in March of this year, and the next summit will be at Tarrant County Community College's downtown campus on September 24th. Our sensor summits bring together entities using non-regulatory sensors, members of the healthcare community, those interested in non-regulatory air sensors, and other stakeholders to discuss and learn about a variety of air quality topics. Next, challenges. So as mentioned earlier, we discovered that NO2 readings in the summer have the possibility to skew high due to our high temperatures and high humidity. Pod security. So we actually had, unfortunately, one pod stolen already. It was a sensor pod at Holcomb Park. We also discovered last week that somebody maybe had attempted to steal one of the pods at Mars Prosperity Park. Is on our dashboard, the data stopped recording for that sensor pod, and we drove to, Maritza and I drove to it, and the cord was actually loose. It's taken off. So yeah, so what we ended up doing is raising that pod up. But we're also looking at different measures, security measures to use when installing sensor pods going forward. Power. So sometimes the batteries of the solar power may struggle to have enough charge to power the sensor through the night. Some pods have had PM pump failures. Some of the pods have had software glitches that we had to resolve. We had to replace some parts under recall. And of course, we have the challenge of 2 staff members, Maritza and I, balancing our time between decamp, maintenance, and operation versus time for our other projects. Next steps. So data analysis application, we're procuring services to analyze the air sensor data so we can post reports online in a more timely data. We're also working on our dashboard to make it more mobile friendly. TTI will be analyzing and summarizing the data from the West Dallas Environmental Justice Grant Project. Work on the Forest District Grant funded project will ramp up. We're in the process of purchasing spare sensor pod parts and components. The electrochemical sensor in the pods lasts about 2 years. So the sensors are coming to their end of life in the first 5 sensor pods that were installed. So in the new year, Maritza and I will be taking these sensor pods down, rebuilding them, and then running them through the co-location process again. And then we'll explore new ways to bring awareness for decamp program. Any questions? And there's that picture, there's our pods going through the co-location process. Kevin?
So with your battery situation, you said that some of the ones were struggling to power overnight. Is that just on overcast, extended periods of overcast, or is it consistent even on sunny days? And the reason I'm asking that is I'm wondering if maybe the internal batteries are reaching their lifespan as well.
Yeah, it's mostly during the kind of cloudy days, or we had many days of rain. Cloud.
Okay.
It does, but I have actually taken one of the solar panel units apart, and I am looking at the battery and get that tested.
And have you made sure that the heaters are disconnected?
Yes. Yeah, all the heaters have been disconnected.
You have a raised hand.
Sure.
Maggie?
Thank you so much for your presentation.
Hello, Maggie.
Sorry, can you hear me?
Yes.
Awesome. Thank you so much for your presentation. I'm just curious how you guys decided which monitors to purchase for this program.
I can answer.
Yeah,
that.
I'm going to refer to that.
It was low bid.
Low bid.
We were required to do a bidding process,
and
the two systems that met the technical criteria were the Iroquois and the AQ Mesh, and they both had advantages and disadvantages. But the AQ Mesh was slightly less expensive than the Iroquois, so that was what we were required to purchase. And in hindsight, I don't regret that. There's certain advantages, especially for the city operations, to the AQ Mesh. It doesn't require a large external battery like the AQYs do, and they have designed the solar panels to match the unit, the sensors, so that for the Iroquois, when we did Breathe Easy Dallas, we had to purchase separate solar panels and separate batteries. This was an all-inclusive system, and it, for us with limited staff and limited technical, abilities, this was much easier to work with and install. So in hindsight, I don't regret selecting this system.
You had fairly stringent technical requirements.
Yes, we had stringent technical requirements that eliminated a lot of the other systems that are out there, and these were primarily the only two that met our technical requirements.
Got it.
Yeah, they're great. I mean, they are pretty light, especially if you're up on a ladder installing them. Same thing with the solar panels. They have option to run, as you can see this cord here, to plug it into the solar panel, or if you have AC power, what was it, 120 volts or 110 volts, you can use an adapter and plug it into socket.
Got it. Thank you so much.
And then for those of you, so there's a cellular antenna. Here's the intake for the PM. Inside there's a pump that draws the air in for the PM sensor. Comes out there. On the bottom are the electrochemical sensors. Yes.
I also had one final question.
Oh, sure.
Danielle, can you read the question in the chat from
Oh, I can read it out loud. It was me. Sorry. So it sounds like you need one more person. How sustainable is the program? Like, what are their plans for longevity? It's great. I love it. I do. I really do. But like, you need a little bit more help, especially for me personally, for that outreach portion.
Right. So we are, hopefully we'll get some enhancements in the upcoming budget to get at least one more person on the team. Once that happens, we'll probably look at purchasing more, expanding our sensor network as well.
Thank you.
Yeah, Freddie, I was wondering, is that transmitting in real time?
What you see on the dashboard, or Yeah, so.
From the monitor
From the monitor,
itself?
yes.
Okay, and is it displaying on
There's
the
a slide
dashboard
button.
in real time?
No, not on the dashboard, because it actually goes right up into the cloud, goes over to England. Yeah.
Okay,
They do the calculations and then put it back up on the cloud.
how often is that updated?
I don't know, continuously.
I think there's about, when I was doing it, I don't know, still this way, but when I left, it was about a 30 to 40 minute delay.
Okay, so it's not like 3 days?
No,
Okay,
it's
that was my
the way I refer to it
Okay.
is near real time.
And it's also pretty cool. I like the safety mesh pod. I don't know the error calls, but I can connect my laptop to it and do some troubleshooting to it. I can make the pumps work. I can see if the antenna is working.
I think the amount of progress that's been made since I first became involved 3 years ago or so is remarkable. But we are also, I think, very honest about the fact that we're a work in progress.
Oh, yeah.
And that one of the interface areas, the timeliness of data, and the linking to the health data so that we can accurately portray what the risks are some of the challenges that we face that we need to keep in mind and work on. But the fact that we've gone from virtually zero to this level is pretty remarkable achievement.
Actually, continual improvement, like you said, we've come a long way, but we still got a lot. Yeah.
What about calibration? How often do you have to take them down to recalibrate them?
So far every 2 years.
Okay.
So when we rebuild the sensor, we recalibrate it. But we're thinking.
You do what?
Oh, sorry. When we rebuild the sensors, the electrochemical sensors.
Okay.
That are in here, it lasts about 2 years.
And how expensive is that?
They are a couple of $100.
Okay. But you do that on site. You don't have to.
Yeah, we just take them down, take them to the office. It's really easy. I can take this off later.
Are you still co-locating with the TCU sensors?
Yes, I did. Yep.
That's similar to our sensors. So ours, they recommend a year before they replace the sensors.
Okay.
As far as from the Breathe Easy study, we actually looked at, since we had them at the regular tarp site for 18 months, we actually looked at the performance to see how much they degrade over those 18 months. And it was surprisingly small, the amount of, so comfortably, yeah.
Okay.
And we're also looking at maybe purchasing an extra one, being it the golden sensor, and that we keep that hidden and then take it out and putting it next to one that's already on the field just to make sure it's being accurate. I mean, luckily we had, this is one from our Martin Weiss Rec Center, which is about 100 feet away from the TTI sensor that Jeremy had. And I was looking through the dashboard and I could see an error in, well, the PM 2.5 was really high. So I talked to Jeremy and he's like, hey, what's yours reading? And he told me, and I was like, okay. So there must have been something wrong. And so we took it down and like I said, we plugged in my laptop to it and was able to see if I could turn on the pump itself. I wasn't able to. So, concluded that the pump was gone. It was bad.
So I have to ask this.
Yeah.
When I left in September of 23, the city of Dallas was looking at purchasing some additional more accurate sensors. Has that been put on hold, or is that dropped, or where does that?
That's put on hold. Yeah, we're still considering it. It's just looking, of course, it's just where it's a 9 capacity. So if we get another person, or if we get 2 other people, hopefully, I think we are trying to actually get 2 other people. We can look at getting a type 2. What's it? FEM.
Well, they're near FE.
Yeah, near FEM. Yeah, which is a mobile one.
Or FRM.
Yeah, FRM.
All right. Well, thank you so much. Probably need to go ahead and move on to our next presenter. Our last presenter is Juliana VandenBorn from NCTCOG.
Okay. Hi, everyone. I'm Juliana VandenBorn with North Central Texas Council of Governments. I'm an air quality planner here. So next slide, please. This is just what I'm going to be talking about today. So, so as you all know, North Central Texas Council of Governments is the regional planning agency, but also the NPO. And then maybe if you didn't know, it also hosts the Dallas-Fort Worth Clean Cities Coalition. And that's a Department of Energy partnership that focuses on clean transportation. And our Dallas-Fort Worth Clean Cities Coalition is staffed by our Clean Fuels and Energy team, which is led by Lori Clark. Next slide. So obviously we're all here today because we're concerned about local air pollution in the region. Air pollution directly impacting human health every day. The local air pollution and criteria air pollutants, which the EPA we've talked about a lot today, identify which are impact human health negatively. And then I also have the greenhouse gases listed. And the difference is that greenhouse gases go up into the atmosphere and really affect the world's air quality, where primarily criteria air pollutants are considered to impact local air quality more so. So next slide. So ground level ozone is a primary criteria air pollutant of concern in our region. Currently 10 counties are in non-attainment for that pollutant. And obviously health impacts of ground level ozone include coughing and sore throat, inflamed and damaged airways, aggravating lung diseases like asthma, like we've talked about a lot today. Next slide. In the other criteria air pollutant of concern is particulate matter in this region, particularly PM 2.5. So the illustration here, you can see at scale, we've got a human hair and a fine beach sand. And then the particulate matter 10 are the blue dots on the hair. And then the fine particulate matter 2.5 are the pink dots on the PM 10 blue dot there. So particularly impacts health through respiratory issues and heart issues. For fine particulate matter, once that's in your lungs, you can't cough it out. So also very concerning criteria air pollutants. Next slide. This is just showing how different sectors emit greenhouse gases. So we can see here transportation and mobile sources and the energy sectors are contributing the most in our region. This is from the 2019 greenhouse gas emissions inventory. The energy sector is broken down into three sectors. So that includes the commercial energy, industrial energy, and residential. And this includes like all of the carbon dioxide equivalents. So what I showed on the other slide, but specifically carbon dioxide, methane, and nitrous oxide. Next slide. So just a little bit of background on air quality issues. I know all of you are probably very familiar, but now jumping into the Dallas-Fort Worth Air Quality Improvement Plan. Next slide. So North Central Texas Council of Governments is serving as the lead agency for the Dallas-Fort Worth Arlington Metropolitan Statistical Area under the EPA's Climate Pollution Reductions Grant Planning Program. Mouthful, but CPRG, as we call it, is a two-phase grant program which provides grants to develop and implement plans for reducing greenhouse gas emissions specifically. And the first phase of the CPRG planning grants, EPA provided $250 million for non-competitive planning grants to develop regional plans to improve air quality. NCTCOG was awarded $1 million in funds from the planning grants on behalf of the region, and as the grantee, developed the Dallas-Fort Worth Air Quality Improvement Plan, Priority Climate Action Plan. So that was submitted on March of this year, and the goal of the Priority Climate Action Plan is to collaborate with regional entities to create a roadmap for the region to improve air quality, protect public health, and reduce impacts of extreme weather events by 2030. So you can read the full air quality improvement plan on NCTCOG's website, or we're also releasing an executive summary soon, so be on the lookout for that. It's much shorter if you don't want to read the full 155 pages, but we encourage you to.
Great summary.
The second phase of the CPRG grant program are the implementation grants, where EPA held 2 competitions for $4.6 billion to actually implement the plans developed under the planning grants phase. So NCTCOG did apply for the implementation grants in April and requested $199 million. EPA just announced these selections for the implementation grants on Monday. They received 218 applications with requested funding of $33 billion, which is nearly 8 times what of the available funds. So unfortunately, NCTCOG did not get selected for the implementation grants, but intends to carry out the measures outlined in the air quality improvement plans through other means. So as a recipient of the planning grants, NCTCOG is also required to develop a comprehensive climate action plan, which is what we are working on now, and that will be due in June of 2025. So next slide, please. So this is just a timeline of the development of the Priority Climate Action Plan. There was extensive engagement conducted to develop this, consisted of meetings with the public, local government stakeholders, NCTCOG committees, and we also have a public and stakeholder survey to develop this plan. Next slide. So the public survey was intended for community members, advocates, member of the general public, and we received over 280 responses representing 12 of the 16 counties in the NCTCOG region. And you can see the orange dots represents range of survey respondents, so a high volume in Tarrant County. Next slide. We also had a stakeholder survey specifically intended for entities that wanted to implement measures. So results from both surveys show that most respondents' biggest concerns are local air quality, climate change, and public health. Next slide. This map is showing climate vulnerability for the DFW region, which helps show which communities face greatest challenges from the impacts of changing climate. So health concerns included in this overall climate vulnerability scores are things like overall physical and mental health, access to care, chronic and infectious disease, temperature, disaster, and air pollution related deaths and related illnesses. So now I'm going to briefly go over all of the measures outlined in each sector of the plan. Slide. So this slide just shows the community benefits achievable through implementation of the measures outlined in the plan that go beyond direct air quality improvements. So things like improved health and well-being, green spaces and community beautification. Next slide. And then these icons are showing the direct air quality benefits achievable through implementation, specifically air quality benefits, reduction in criteria air pollutants, and then climate change benefits, meaning reduction in greenhouse gases. Next slide. So for transportation sector measures, Included in the plan promotes more efficient use of transportation system and a shift toward vehicles with lower emissions. So measures include improving and expanding alternative transportation options, so public transit, bike paths, pedestrian walkways, mitigating congestion, improving railroads, and incentivizing carpooling, and also the use of alternative fuels and fuel saving strategies like idle reduction. Next slide. This is just the other transportation sector measures, so that I just mentioned. So next slide, please. So for the energy sector, the measures improve efficiency and resilience, so offsetting the need for traditional power generation and reducing emissions from power plants. So updating building codes, improving energy usage of public facilities, so adding energy storage, solar, upgrading lighting, upgrading HVAC systems, solar installation. So next slide. So the water, wastewater, and watershed measures promote more efficient use of water, enhance existing water conservation measures, reduce local pollutant sources, and promote more sustainable drainage infrastructure with an emphasis on solutions that provide multiple benefits. Next slide. So the water, wastewater, and watershed management sector measures continue. It's going to include water and wastewater system upgrades, related system energy efficiency upgrades, increasing local stormwater storage capacities, and implementing nature-based solutions. Next slide. So materials and management sector measures address several identified resource conservation and waste management challenges, such as resource management facility capacity, locations proximate to local growth, organic and construction materials, reducing emissions associated with longer hauls to existing waste management facilities. Next slide. Agriculture, forestry, and land use measures primarily address an overwhelming public response to the need for more and better quality green spaces as a means of reducing heat island impacts, urban flood response, and as well improving local air quality and enhancing, overall community well-being. Next slide. Some of the measures we identified in developing the plan didn't really fit into a single category because they involved multiple sectors of emissions. So measures included in this section provide education and outreach about energy efficiency, sustainable practices, clean energy across multiple sectors. So as you can see, these laid out here, the tire recycling initiatives, carbon footprint app, which promotes carpooling and car sharing. Next slide. So again, as lead agency, NCTCOG is also required to develop a comprehensive climate action plan under the planning grants. So this is the step that we are in now. We are currently working on greenhouse gas inventory for the region and developing sector-based emission projections. So that will be for 2030 and all the way to 2050. And this will be due to the EPA in June of 2025, as mentioned earlier. Next slide. So just wanted to get any feedback. I know that was a lot.
Yeah, probably in the interest of time, we're going to have to go ahead and wrap up. Maybe we have time for maybe one question.
Let me just say comments.
Sorry.
I've got a number of comments, but I'm going to save them in the interest of time.
Yeah, and if you have any questions or comments, please feel free to email us after the meeting.
Or go in and do the survey.
Yeah, surveys online are still open, so
there you go.
Please leave all your comments there.
I meant for the whole like meeting for today.
Okay.
So yeah, but if you have, yeah. So I guess thank you very much. Thank you all for joining us today. Yeah, like I said, if you have any questions or comments after the meeting, just get in touch with us. And our next meeting is October 24th. If you have anything between now and then, just let us know. Thank you so much. Have a good rest of your day.
Thanks, everyone.
Thank you very much.
Thank you.
So does this
Do you have any suggestions of
There's gonna be two seats.
Dallas gonna have to start referring to
Yeah.
landlord harassment thing?
I don't know. And